First up, we have Cindy Gillum, a registered nurse with 13 years of wound care experience in the clinical. She is the clinical director for West Reaplix. She is dedicated to improving care for hidradenitis suppurativa patients, inspired by her niece's journey with the condition, and aims to bridge dermatology and wound care for better patient outcomes. Everybody give a great big round of applause for Cindy Gillum.
Thank you, Frank, and thank you guys for having me after lunch. This is usually when everybody goes to sleep, right? So since Dr. Oha was here earlier and she talked about everybody walking 5 miles after lunch, that's what we're going to do right now, right? Just teasing. So I wanted to bring some of my experience, but I wanted to also tell you who I am. So I am Cindy Gillum, and I've been a registered nurse for 13 years. I've been in wound care for 13 years. I knew, since this was my third career, that I wanted to be in wound care. I was a burn patient, and I was a biology major in college, so the whole healing cascade really just made sense to me from a cellular perspective. But what I went through, I'm not a burn advocate, believe it or not, I'm an HS advocate. And the reason that I am is because of my niece, as Frank said. Thank you, Frank. We have been on this journey together for about 15 years. And not everybody has an aunt who's a wound care nurse who can tell them what products are good and bad. I will tell you she has the best of the best doctors. Dr. Chris Syed is her doctor. And I've even done some education with him. So, you know, I had some great conversations at lunch this afternoon. One of the key takeaways I will tell you is that you need to be your own advocate. Do your own research, find out what works for you, and stick to it. And if you firmly believe something is working for you, advocate for that with your healthcare professional. Because we don't know everything, right? Contrary to what I tell my children, I really don't know everything. So anyway, we're going to go ahead and get started. How do I advance these slides? Is it this little guy here? All right, thank you guys. Maybe I'm not doing this right. There we go. All right, so navigating the wound care field is really difficult, and I'll tell you, after being in wound care for the last 13 years, it is one of the fastest growing specialties that's out there. I'm on the industry side now. I don't practice anymore. I stopped practicing about a year ago. I do consult on patients here and there as a side business, but primarily I work in the industry bringing new technologies to market that can help patients close their wounds. So for years and years, I told people I just patch holes for a living. Now I help the companies who I think can patch holes get to market. So that's what I really do now. So even being in the industry and being in wound care for so long and seeing patients on a wide variety of spectrums, what I see is that we just can't keep up. There's so much great information out there, and you guys saw this morning that amazing presentation on all the research that's being done just in HS. Imagine all the other wound etiologies that are out there. It's really hard for us to keep up as professionals. So I say all of that to say this: let me help you navigate today what works for you. So just show of hands. I'm going to ask everybody in the audience who has HS. If your primary concern is pain, raise your hand. Okay. If your primary concern is drainage, raise your hand. If your primary concern is odor, raise your hand. And how many, just by show of hands, because here's what I'm teaching my colleagues. I didn't know this. My niece, when she went through her first de-roofing procedure, which to me, by the way, is very minor, a procedure, because what do I see every day? I see the worst of the worst of the worst. So a de-roofing procedure may seem minor to me, but how many of y'all have gone through a de-roofing procedure and come out on the other side and went, what the hell just happened to me? Show me your hands. Because that was what blew me away. When my niece, Melissa, who is very well educated, she's a Pulitzer finalist, she wrote an article about HS in the Huffington Post. She is a fierce advocate for herself with a fantastic physician, said, Aunt Cindy, when I went through that procedure, I thought it was going to be a closed procedure, and now I'm disfigured. That broke my heart. So as a wound care professional, we can do better, right? I don't ever want my patients to feel like that. I want to empower them to, and I want them to feel comfortable enough to come to me and say, tell me what to expect afterwards, right? I need to be able to explain to them so that they don't come out on the other side and go, oh my gosh, I'm disfigured. And we look at that as healthcare professionals and think, oh my gosh, that granulation tissue looks great, right? And you're going, what? Wait a minute. So it is really hard to navigate through these products, these procedures, know all the terminology. So I do, when I see blank face in front of me with a patient, I do try to slow down and say, okay, take the time as a clinician and say, tell me what's going on. I can see that you're concerned. What's going on? So please take that time with your physician and be very, very open and honest about your feelings. Because how many of you also feel like there is a mental health component to this disease? Almost everyone, right? And we're going to talk about that with one specific product in mind, actually. So how are you going to know if it's going to work for you? And how many of y'all have spent hundreds of dollars on products and just thought, I don't want to spend another dollar on these products and think, is this actually going to help me? I see that all the time too. So how do you know which ones are going to be good? And guess what? You guys today can reclaim your body, and you can go back to your physician and say, these are the products that I want, and some of them I'm going to give you. You can buy yourselves over the counter. So I live by the KISS principle. Keep it stupid simple, right? We're going to clean it, we're going to protect it, dress it, and then we're going to cover it. Those are the three things that we need to do with wounds, period, amen. And by the way, wound care is never sterile. We are very clean, but it's never sterile, okay? So there's so many different dressing options that are out there, and some of these we're going to talk about. So foams are a dressing that are very thick. They're padded, you might see. There's some fantastic foams that are out on the market. Those are meant to help us with drainage. So foams are going to have the most absorptive qualities, and there's some fantastic ones that are silicone bordered, because how many of y'all are also tired of tape? Yeah, I hate tape. And dermatology in the room should really appreciate the fact that we really do damage to the epithelial cells on the tissue when we're constantly removing these cells with tape. And I'll show you what that looks like in a picture in a few minutes. Transparent films, not necessarily my friend, and they're not necessarily yours either. They're basically an adhesive, but overuse of these products will cause that tape problem that you see quite often. So try to steer clear of those transparent films. Alginate. This is a product that's used to wick fluid away. Whoops, I didn't do that. How do we go back? Alginates are made from seaweed, and they have highly absorptive properties. And we use that oftentimes in wound care when there is too much exudate and we need to have a way to absorb that drainage for a longer wear time of some of these dressings. So it can be used as a primary dressing sometimes. And when I say primary, meaning that that's directly in contact with the wound, but you might have something as a secondary dressing like a foam to protect it and keep it covered, okay? Gelling fibers are also very similar to alginates in that they're very highly absorptive. So all of these things, your alginates, your foams, and your gelling fibers are your friend when it comes to needing that, that absorption. Collagen. I'm going to tell you about a product today that's my absolute favorite in wound care. Don't tell my boss because it's not my product. But it is a game changer for my niece. There is no cookie cutter answer for HS patients, but the science behind the product is phenomenal, so we'll talk about that. Collagen is the most abundant protein on the planet. It's made in our bodies, it's in plants, it's in animals. It is the scaffolding that we need for good, strong, healthy tissue. There are biologic products out there. There's cellular tissue products out there. The cellular tissue product market at the moment is in a state of unrest, we'll say, on reimbursement. But there are some fantastic options that are out there that can help heal some of these hard-to-heal chronic wounds. Antimicrobials. So that odor that some of you guys have expressed is really burdensome on you. A lot of times a good antimicrobial can help offset that odor when we balance the pH and we're also managing the microbiome. And then hydrocolloids, again, going back to that transparent film, hydrocolloids are not your friend. So if you ever see that word on a dressing, they do have good autolytic debridement properties, but from a nursing standpoint, I can tell you that they're really good at ripping skin. So if your skin is very friable, when you go to remove some of these products, you can do more damage than good, okay? Gauze. We have a saying in wound care, the most expensive therapy is the therapy that doesn't work. And unfortunately, for the doctors in the room, they'll probably shake their heads and nod at me when I say this. Our medical school students are taught wet to dry still. I see a few nodding. Wet to dry is the enemy, okay? In fact, in Christopher Syed's office, I was telling him, can you please at least consider wet to moist? And I gave him the rationale that when you do a proper wet to dry, you're doing it twice a day. You're removing dry gauze from a wound, and you just spent all that time gaining new cells, and you've just ripped them out through non-selective debridement. He said, you're absolutely right, but I can't change my IRB now. So, so I did at least get the wheels turning. So we're talking more and more about that. And he's the reason I'm here actually today. Medical grade honey, you guys heard a lot about Manuka honey and how that's pollinated by the bees in Australia, New Zealand. It is a medical grade honey. It's not something you buy off the shelf at your local supermarket. It does have some anti-odor properties. It also has properties that are antimicrobial. Be careful with honey though. First off, if you have sinus tracts, you may not want to use something that you can't reclaim back out of your body, okay? So that's concern number one. Concern number two is we do want moist wound healing, but unfortunately sometimes Manuka honey and medical grade honey will actually produce more of an overly wet environment than what we really want. So be very, very careful with that and talk to your physician before you start using that on your own, okay, to see if they think that you're a good candidate for that product. And then barrier products. I cannot stress this enough, and the derms will love me for saying this. Protect your peri-wound skin. That skin is intact. That skin that's around these abscesses, these lesions, these tunnels, these tracts, we want to make sure that skin stays good and intact. So to do that, we have great zinc-based products that are off the shelf in your supermarket, your drugstore. My personal favorite is calmiceptine. I know that's a mouthful, and I can tell you how to spell it if you find me afterwards. But they have a fantastic zinc-based barrier product that really protects us from getting overly wet, what we call maceration. How many of y'all have been in the bathtub too long as a kid and your fingertips turn white? That's maceration. Your skin is overly wet. That can happen in these areas too because we have a lot of sweat glands in your groin, in your axillary region, and we want to prevent that tissue from being damaged, okay? Questions so far? All right, y'all are with me. So that's what the tape looks like. When you've used too much tape, that little picture there on the left, your skin begins to break down. We're going to start stripping those epithelial cells until we get down to dermis, and we're going to get a tape damage. And now, guess what that is in my world? Wound care, right? So you've just created even more job security for me and my colleagues. And that's not really what we're after. So we're going to talk about hydrowear. We're going to talk about securement devices and garments. There you can get netting that can help. There's also a tube grip that can help in some of these areas hold dressings in place versus tape. Paper tape is far better than an acrylate tape. And then there's also skin prep or skin protectants that you can put on your skin so that whenever you do remove that adhesive, you're only stripping that product, not your skin, okay? Most often it's just called skin prep. So if you Google skin prep, you'll find it. It comes in little pads. They almost look like alcohol swabs, and sometimes they even come in a spray. Wound cleansers. How many of y'all are using hydrogen peroxide? Okay. If you are, stop. If you don't want to be embarrassed by sharing but thank you for being brave to say that. Like I used to use that and I don't anymore. It's very cytotoxic, meaning it kills your healthy cells. Stop today. If I teach you nothing, let me teach you that. There's amazing wound products that are wound cleansers specifically designed to bring the pH down. Why do we want to bring the pH down? Because when we balance the pH, we create an environment where new cells can thrive, but bacteria can't. And that's really what we're after here in some of these areas. If you can't get your hands on wound cleanser, normal saline works great, okay? Switch to that. It's cheap, it's easy to get. You can buy it at the drugstore. So you can get a lot of these over the counter. How many of y'all have actually been in the bathroom and seen these? You're welcome. I actually got those for you. I put Jasmine in contact with the people at Ergo Medical who make Vosh. It's a hypochlorous acid. It's very gentle, and it balances the pH in our wounds so that, again, we can create an environment for those good, healthy cells to thrive, okay? It's a great product. I will tell you, I've used this with my niece. She reports to me sometimes it burns. If that's the case, stop using it and switch to saline. It's okay. That just means that you're probably more in an alkaline state, and we need to switch to something that's maybe a little gentler. That's okay. There are also, some people will use Dakins. I'm not a fan of Dakins. Dakins is very cytotoxic. And depending on, this has a massive kill list of gram-positive, gram-negative bacteria, and even fungal. This is a product we use in wound care, but not necessarily dermatology. But my goal in my career for the last 10 years has been to bridge the gap between wound care and dermatology. We as clinicians can do a better job of consulting each other because they have tools that I don't have, and I have tools that they don't have. And we can certainly work together. So if you see your dermatologist, say, please can you get in touch with a wound care professional in my area, and let's collaborate on an interdisciplinary approach for these wounds. Okay? Again, be your own advocate. There is a guide that I have created specifically for HS patients designed around wound care. It gives you a peek of my brain and how I go through thought processes. If you want that, you can email me at that email that you see right up there on the slide. You can also find me on LinkedIn, and I'm happy to share that document with anybody. My goal is to educate. That's what we do as nurses. So we're going to do a wound care demonstration, but before we do that, do you guys have any questions so far? Yes, ma'am. She's coming.
Can you hear me? Okay, there we go. Hi. So for me specifically, like my wounds don't drain. So they just are constantly just inflamed. Mm-hmm. So would you still kind of offer the same advice as far as wound care for drains or for non-drainage, if that makes sense?
Well, so again, it comes back to that personalized care. If you don't have drainage, I'm not going to give you an alginate, I'm not going to give you a gelling fiber, and I may not even give you a foam. You don't need those types of products to help you wick away that moisture. But if your wounds are dry, which I would want to know, if they are dry, I do want moist wound healing. I don't want it dry. We may need to lend, in other words, that may be a good place for the Manuka honey that we discussed to kind of give you a moist wound environment, but also keep it pH balanced and give you some antimicrobial protection as well. Good question.
Like as if you got like an injury. They don't drain like that. It just stays like an open wound for months.
I have a beautiful product that I'm going to demonstrate for you, and you're going to love it. It is my one size fits all, but at the same time, it will address your problem as well as somebody who also has a ton of drainage. So hang tight. There was somebody else that had their hand up behind you, I believe, or in front of you. That's okay. We'll get to them. I think we still have some time. Are we good on time? Okay.
Okay. So I have this wound under my armpit that I named her. Her name is Keisha. She has been
love
here
that.
for forever, and she's always draining. Like I'll get a nodule on the side, and then she'll start draining. She's just always flowing. But the armpit is just a really weird place because if you're in movement, like it can't always, like the tape can't stick. I'm allergic to adhesive tape. Mm-hmm. So I start like breaking out, and now I've started to have issues with paper tape, even bandages, like how they put them
Silicone
for
is your friend.
Okay.
So start using a silicone. I'm going to pass one around here shortly. It's very gentle to the skin. You can lift it and repeatedly over and over, I think about 7 or 8 times before it loses its tackiness. Mm-hmm. But it's not stripping your skin cells, which is great. And that the one that I'm in particular going to pass around is fenestrated so that fluid can pass through it. So if you wanted to put a secondary dressing to capture the drainage, you could, like a foam.
Ooh, okay.
Yeah.
Thank you.
Great question. Anyone else? I know I saw a couple other hands. There's one in the front here.
Besides household cleaning, are there any good uses for the hydrogen peroxide?
No.
So I'm like, I can still use it for that.
I love it as a bathtub cleanser and soap scum remover, which tells you how cytotoxic it is to your skin.
Great point.
Yeah.
The other question that I was curious about for the silicone, is that good for athletes? So people who we know we're going to have a lot of movement and running and all of those different things.
It's perfect for athletes.
Awesome. Thank you.
Silicone is your friend. And I've even learned in the plastic space, our plastic colleagues have a product called Silogen. It comes in sheets and it comes in tape strips. They sell it on their shelves, and it's also used as a scar cream, but that stuff will hold anything on. It's fantastic. So derm guys, go look up Silogen, FYI. They also have a scar gel called New Gel that's direct to consumers, NEWGEL, I think, that's on Amazon. I tried the Silogen version, which is kind of the medical grade version. I had an old scar on one of my hands. I couldn't even tell you where it is anymore. I'm like, let me just see if this works. It worked. Great stuff. There was one in the back. New Gel, NEWGEL, or Silogen, SILAGEN.
I'm sorry, I wasn't sure if you mentioned it, but I was using KT tape as a bandage over my gauze. What do you think about that?
Is that like the
The athletic tape?
It's pretty strong. So athletic tape is meant to stay in place for days and days and days. If you think your bandage can stay that long,
It did, yeah.
then we're golden. But if
Okay.
you have a wound that's draining and requires more than 2 or 3 dressings a week, then I wouldn't recommend it.
Okay. Also, is it true that blowing on your wound can like put bacteria on it? Okay.
Yeah, don't blow wounds. There was one right back here.
Okay, hi.
Hi.
So I have a wound under my underarm, and what I found with my wounds is that they burn really bad and they itch really bad as they heal. Is there anything that I can do to help that? It's killing me.
I would say yes. Try a really, really good wound cleanser. Try to balance that pH. The itchiness, I'm not so sure that I can help you with that part of it. Or it could be, maybe my derm fellows here could help me out. That could be an allergy to whatever you are using currently.
I currently don't put anything on it because I find that if I use anything on the wound, it clogs it pretty much. And then if with not having anything on it, using gauze, it causes it to stick to the wound, and then I'm ripping the new cells, like you said, off of it. So I'm kind of stuck here. I really am. And I see your answer.
She's like, yes, girl. So
Which is help with itching.
Yes.
And so there's like several of us that they just like have that HS itch that use it, and it's like the only thing that's works for us. And then have samples that you can just take out there.
all right, let's take one more question, then we're going to move on to the demo, and I'll be here afterwards, so if you have questions, we can do that as well.
Oh, okay.
I don't know if it's a question, but I grew up on the Atlantic coast, and I found swimming in the ocean to be so helpful for skin. And so I know some people, lucky people I suppose, have access to their own personal saltwater pools, but what are your thoughts on that sort of thing?
Great question. I am not a fan of an open wound going into, submerging into any kind of water. And the reason is you don't know what bacteria is in that water. And remember that I live, my paycheck comes from complications, right? I mean, if I know a surgeon, it's not a good thing. But oftentimes where I see necrotizing fasciitis, which is that flesh-eating disease, comes from open water. Or stagnant lake water or river water. Correct. Well, that is salt water, but there is bacteria in salt water, and you don't know what's in there that could cause a problem. So I just don't recommend anybody with an open wound to go swimming until it's healed. So hang on to that question. My beautiful assistant here, Krista, is going to help me with the demo part, and Fatima is going to help me by passing around some products that you guys can touch and feel, because I'm that kind of nurse. I don't even want to use products until I touch it, feel it, play with it. So why would you want to use something until you touch it, feel it, play with it, right? So I'm going to switch to this here, guys. So to keep this moving, my friend Suzanne Maloney, how many of y'all know who she is? Several of y'all. So she is an HS patient. She developed a beautiful product, and I knew about it through my niece and Dr. Syed for HS patients, and I thought, oh my gosh, I have so many patients in breast cancer, in lymphatic issues that would benefit from this product as well, but it's designed specifically for you in the room. So Krista's wearing actually the t-shirt. Lift your arm, Krista. You can see if you turn to the side this way or that way, these little holes that are in the side of the t-shirt. So Suzanne was tired of her clinicians telling her to use maxi pads under her arms, in her groin. and thought, we can do better, right? We can find something that's a better solution. Now, little did I know that she had come up with a dressing system for this. So the pads actually come in 2 sizes that go along with this, and there is a super absorber in here, so you wouldn't need an alginate, you wouldn't need a gelling fiber, you wouldn't need another foam. This is a whole complete system. It's called HydraWare, and your doctors can order it for you. So the way that this works, okay, direct towards me. So if Krista was out with her friends and having a nice night out on the town, and she had a wound and she carried an extra dressing with her in her purse, all she simply needs to do, I'm going to get really fresh with her, guys, is take out the pad that was originally in there and, sorry, my hands are freezing. She's going to slip this in. The foam side goes to the wound, to the skin, because remember, foam holds fluid. And these are little Velcro tabs. Lift your arm all the way up. And they go on top where those holes are, and you tuck them in. There we go. So that, how long did that dressing change take? Like no time. So if you're out with your friends, part of the thing that Suzanne and most of you are frustrated with, she's showing me raise a hand right now, that I'm out with my buddies and I don't have a way to do this quickly, and I got to go to the public bathroom to do it, right? Right? How comfortable is it?
Very, very comfortable.
So this is almost like, and we're going to pass the garments around. This is almost like that Nike Fit material. So it does kind of have like an antiperspirant property to it. It wicks that fluid away from your body, which is nice. Okay, perfect. Thank you, ma'am. And if you will walk that with this through this side over here, there's a bra garment. Krista's going to bring the garment over here. Fatima, how many men are in the room with HS? Not one? Shut the front door. I thought we had some men. Okay. So for the men, we do have briefs, which is great because they get it too. And guess what? There's places in the rear end for the men so that they can actually change that dressing themselves as well. So if you'll start on that side of the room, these are going to go through because I want you again to touch it, feel it, play with it. This is the women's brief. Both sides, very comfortable, just like your yoga shorts, right? And the way that these holes are designed, they're not going to dig into your body, okay? So Fatima, can you send this one to the middle of the room? So I want you guys to really look at these garments. These are available here in the U.S., even though she's over there across the pond in Ireland. She's designed these for all of you guys, and you can get them through your physician. If your physician has questions about how to order it, come see me, or send them my way, and I'll tell them how they can order it. Okay, so let's talk about, one of you guys asked a question, it was you, asked a question about, I have a dry wound and I have a tunnel, what can I use? So remember I said collagen is the most abundant protein on the planet. This is a product called Prisma. Its sister product is called Promogran. This is solely a wound care product, so if you're a derm, listen good. It's collagen and ORC. ORC is oxygenated regenerated cellulose. Both of those things are native to our body. When we have high levels of MMPs and elastase, we're in this inflammatory phase, this gives those MMPs something else to chew on, so it's a sacrificial substrate. It's 100% bioresorbable. What does that mean, Cindy? It means that I don't have to worry about fishing something foreign out of my patient's body. It's going to be completely absorbed by your body because it's native to your body. Now, Prisma The one with the S has silver in it, 1%. So it's 45% collagen, 44% ORC, and 1% silver. I'm sorry, 55% collagen. The Prisma is double density, so you're getting more bang for your buck, which is why I like Prisma more. That silver is not enough to cause silver toxicity in the patient. So I just opt for the silver myself, and it's not any more price-wise. This small square, this is what I use on my niece. And I can't speak for it, but Chris Syed can tell you that her wounds have healed really quickly. So all you do with this product, and where's Fatima? Here she is. There's 3. If you'll send one left, right, and center so people can feel it, touch it, play with it. It also comes in a big 8x8 octagon shape. You activate it by getting it moist with saline, or they can use Vash, or guess what, if they put it in there dry, it's actually the fluid from their draining wound will activate it and get that going. But typically I'll get it wet with a wound cleanser or some saline, and then when I do that, it kind of forms like a little gel and shrinks up. It comes in that nice little kit, so I just do it all in that little tray that it comes in, and I'm gonna pass this around too so you guys can see what it feels like. And this can go anywhere. Now, the beauty of this product is insurance will pay for this 1 a day. 1 dressing a day. It's one of the only things that they will do like this in the wound care space as a daily dressing. The body won't absorb it that quickly. You'll have way more Prisma than you'll need. So Fatima, if you'll pass this around, this is kind of gelled up now and you can feel what it feels like. It does have a cooling property to it. I'm not sure what that's all about. Maybe because it's moist when it goes in and it's cool and your body's hot. But that's what gets reported to me by patients. I've treated burns, I've treated HS, I've treated pilonidal cysts, I've treated all kinds of things with this product that are hard to heal wounds. And it is safe to go into a tunnel. When I have a tunnel and I put a wound vac on something, oftentimes I'll put that in the tunnel and put the wound vac in the wound because I don't want to fish foam out of tunnels. So this is a very safe product for use, and it is amazing how fast these wounds heal, specifically after a de-roofing procedure or even a surgery where you've had multiple abscesses removed. It's a fantastic product, and it's easy to use at home, but it does require a prescription. And then the last thing there's 2 more things I want to talk about. The next one is the silicone. So this is a Coloplast product. It's called Biotane Contact, and it can hold any dressing that you put on as a secondary. So whenever we pass this around, I want you to just feel it on your skin and feel how comfortable it is. You really can kind of move, and to your point, if you're working out and you're doing some sports, it's not going to shift. It's actually going to hold everything in place. So that's a great product for your patients. And the fact that it's fenestrated allows that fluid to be moved into, I think I have these open. Where is, Krista, can you pass these around left, right, and center? They're already open. So that fenestration allows for that wound fluid to pass through because we don't want to hold that fluid in, right? It can cause a problem there. So we want it to pass through, and maybe you put a foam or a gauze dressing or something else that's absorptive on top of that. And then the last thing, right before I came here, I went to CVS, and I found non-stick pads because somebody said, they already said it for me, I think it was you over here, said, I don't want to put anything there because it sticks to it. Get a non-stick Telfa pad. The whole box cost me like $5. And I know you guys spend a ton of money on wound care products. I want you to leave today knowing which product to get. If you have drainage, get something that's going to absorb. Get a foam. Get a alginate. Get a gelling fiber. Even some of these bandages that we see that are over the counter have absorptive properties. And if you're really not sure, email me and I'll send you that document and you can look more. If you have, if you're in a pinch and you don't have anything with you, stop at your local drugstore and get a nonstick pad and maybe put some gauze under there until you can get home and do some sort of dressing change. Questions for me? Yes, ma'am. That's the collagen. So most collagen on the market is 90% collagen and 10% alginate. At some point, there's something to be removed from that. I like this product specifically for HS patients because of its ability to balance the pH so that cellulose drops the pH of the wound. Again, remember that that's giving an environment where cells can thrive and bacteria cannot. But also, if you're in an inflammatory phase, sometimes there's other cellular processes like MMPs and elastases that are elevated. We don't know that as clinicians. There's no test for that. So what I tell people is if you use this product, if you use Prisma or Promogran and it works, that's likely the problem. But what we see in chronic wounds, there is an element to those two players, those two cellular components. Good question. What else? Yes, ma'am. She's coming.
I just had a quick question. Just who was talking about the ocean? Who said that? Which one? Oh yeah. So I had talked to my dermatologist, and she was like, "Take a bath and put Clorox in there." I said, wait a minute, ain't that for the clothes? So I'm like, what's going on with that? What do you know if that's like an actual thing? Well, I'm assuming it is, but
Dakins solution, it's spelled Dakins if you're taking notes. It is a bleach solution. I always recommend quarter strength, so only 1 part of the bleach to 3 parts water for wounds, but only if they're highly colonized with a horrible bacteria. I wouldn't necessarily recommend it for HS patients. And correct me if I'm wrong, derm fellows in the room, most of the time these are not infected, right? So I wouldn't put Dakins on a non-infected wound. It's very cytotoxic. It's worse than hydrogen peroxide. In fact, the indication for Dakins is only 3 days and then cut. So no, I wouldn't recommend it for that because most likely it's not infected. And you would know if it's infected, right? Because you would have pain, inflammation, you'd have redness and swelling and fever, right? Well, you have inflammation, but it's a different inflammation, yeah. Yeah. Well, same.
Yeah, bleach. Yeah.
6 tomato, right? I don't like Dakins because I think it's cytotoxic. I don't want to give anything to my patients that I think is going to regress us backwards. I'm here to build new tissue, not take tissue away. And to me, this is my opinion, my clinical opinion, I think that the cytotoxicity from bleach solutions such as this, like Dakins, is more harmful than good, unless you have a severely infected wound. And I'm talking to the point where you're in the hospital.
I have a question. And I will say, I have used Dakins. I had a bacterial infection of Proteus mirabilis, and so they prescribed me Dakins, and the wound care nurse did it not for 3 days. It was like 3 months, and that wound never healed. I ended up getting hospitalized again because it's bleach water.
Hurts my heart,
It
yeah.
burns. It was like
does.
the worst. But my question is, in terms of like the silicone dressing that you showed, it's just rough because like as an HS patient, like wound care is not covered most of the time in insurance outside of like now Hydraware and what you were showing us. But like, is there any way that the silicone pads can be
Great question.
prescribed?
So here's where I would employ a couple of things. I'm going to give you guys a lot of power right now. A peek behind the curtain, if you will. If you were to go to Coloplast, who makes that product, by the way, they make an amazing foam with that same silicone that forms to the shape of the wound, so that dressing gets wicked away straight up into the foam and you're not macerating that tissue around it. It's a Biotane also, but I forget what the foam dressing is called. If you go to those Coloplast reps or have your doctor go to that rep and say, I need some samples of this and I need you to tell me how to get this paid for, they know the ins and outs of all of that. Mm-hmm. So I know the ins and outs of the product that I sell. I don't know them for every product on the market, unfortunately. I do know it for the Promogran and Prisma because I used to rep that product a long time ago. So I know how that product works. I know how that product was born. And so work with your doctor to talk to the rep. If you can't get them to do that, you can go on the company's website, and there's usually a contact us, and you can just send them a note and say, hey, I have this disease. How do I get my insurance to pay for this? And they may have letters of medical necessity that your doctors can write. They may have other tools that will help get it paid for. And you may have to do a little fighting with your insurance. I'm okay with that.
All right, and I have one more question.
Yes.
So last week I was in the hospital for like cellulitis in my leg, and so I've been changing the gauze and everything, using paper tape, which now hurts so bad. And because the skin was swollen, now as it's going down, I'm taking off paper tape with like basically the skin.
Try to use a garment. See,
I use an ACE bandage right now because tape is just horrible, but I don't want to have the issue of cutting off my circulation, so.
Don't wrap it too tight.
I've been trying, but you know, sometimes you
Come
just
see
want to
me
be
after.
secure. Yeah, I got
If she has a pearl of wisdom. Okay. Come see me after. I used to work in a lymphedema clinic. Come see me after.
I just wanted to go back to your thing about the dermatologist telling you to use the bleach. As a dermatologist, I think what we're more recommending with that is trying to less of like a Dakin solution concentration and more of like a Vash or a clean wash concentration. It's basically making it yourself. It's basically turning your bathtub into like a swimming pool. The reason I find it not as helpful for HS wounds is that like if it's anything below the waist, like that's easy. You can just kind of sit in it. If it's anything above the waist, it's kind of a pain in the butt to do it and have it actually sit on that area. But ideally, it's not the concentration where you're getting that like burning, it's caustic, that kind of thing.
Right.
So in your dermatologist defense.
Thank you. Thank you. That does sound better. Thank you.
So
Any other questions?
I had a quick question over here. So most of my flare-ups occur under or in between my breasts, and I noticed that the hydrowear, the bralette portion, mostly focuses on the armpits. And I have just started getting into the silicone bandages, but they're still having some issues with just sticking because I sweat a lot right there. So I was just wondering what your recommendation would be, because I don't think hydrowear would work, or I don't know if my system for applying the silicone bandages is working at the moment.
Yeah. Use skin prep. That's my biggest thing. For all of you guys that are using any kind of adhesive, even if it's a silicone base, do invest in a good skin prep, because that's going to protect those good intact skin cells that are constantly being traumatized by different dressings, even if it's a silicone, because the removal of that over and over eventually is going to remove some epithelial cells. So that's number one, get a good skin prep. Number two, I would say come talk to me. That way I can ask you more questions about what you have tried versus what you haven't, and I can give you a little more insight. And then I think we might have room for one or two more, and then I got to make room for the next colleagues, which is going to be an amazing panel.
Just wanted to know if you've heard of the product Dettol.
I have not.
Okay, so that's another soap that was recommended for me through TikTok. And in my comments, people would say use Dettol. You've heard that one?
Yeah,
Oh.
I don't know that product.
Dettol? Dettol. And it's how do you say that word? The chlorhexidine?
Oh, it's chlorhexidine. Chlorhexidine is a good wound wash. I mean, actually, I should say it's a good cleanser, but it's very, for my general surgeon person in the back, it's going to strip everything away, right, Tracy? Like, the problem with chlorhexidine, we use it before patients go into surgery to clean all the bacteria off. So remember, we do have good flora, and we don't want to get rid of that. So when you do wash your wounds, last pearl of wisdom, clean the peri-wound skin first, then take a new piece of gauze soaked with your either saline or wound cleanser, clean the wound twice. So each time you're going to get a new piece, because you don't want to contaminate with things that you've just removed, right? So wipe, toss it, and then clean the peri-wound again. And then use your skin prep or your barrier creams to protect that good intact skin before you dress it. So remember, we're going to clean it, cover it, or we're going to protect it and dress it, and then we're going to cover it. Thank you guys so much. You guys are an amazing audience.